Okay. So we're recording now. If we want to start, we can.
Okay, so here's our presentation and our proposal for moving healthcare organizations and teams forward towards radical belongingness following the COVID-19 pandemic. First, we wanted to start off by defining radical belonging. And so we came up with several different definitions, including being afforded workplace protections from harassment, bullying, discrimination, and violence. Also, being included in the collaborative process to improve the organization's services, being paid equal compensation as another colleague in the exact same position, being respected and valued for the differences you bring that make the organization stronger, and being set up to succeed in your role by receiving support to advance in your organization. So, why is radical belonging important? It is fundamental to the way healthcare should be organized. It provides a protective factor for coping through hardships, finding resilience, managing your stress, combating mental health impairments, utilizing mindfulness, seeking motivators and fulfillment, as well as withstanding change and growth. So, how does it affect the well being of healthcare teams? Well, without it, team members are left to feel undervalued, underrepresented, underserved, unprotected, and ultimately negatively affected mentally and physically, which not only hurts each individual, but it hurts the team, the organization, and the patients we serve as well.
Some members of the IPE team at the M Health Fairview were Kadra and Sarah. Kadra was a family medicine trained physician. She identifies as a woman, wife, mother, person of color, Muslim faith, and Somalian heritage. The way COVID-19 impacted her was that she saw more patients doing more charting, forced to make decisions that made her question her moral code. She has experienced personality changes, including more impatient, distracted, and irritable, and no longer feels safe sharing her beliefs with her team. Sarah, on the other hand, her occupation is a registered nurse. She identifies as white, heterosexual, English-speaking female. COVID impacted her by she saw struggles with seeing patients, those outside of work who do not believe in COVID yet or take it seriously, while seeing the suffering effects the disease inflicts every day on her patients. Frustrated by floors being short-staffed and having to do extra work despite of poor pay. Jessie, she's a nursing home aide, identifies as a female, lesbian, person of color, and of Christian faith. She's of Colombian American heritage. She's bilingual and also married. During COVID, she felt underpaid, micromanaged, and received racial and homophobic remarks from coworkers and patients, making her feel isolated and exhausted. She feels that she's not being utilized as well as she could, such as interpreting for patients when team communication is difficult. Jonas, on the other hand, is part of the environmental service team. He identifies as a heterosexual male of Latin American descent, a person of color, and an immigrant. The way COVID impacted him was that he felt underpaid, overworked, undervalued with no vertical mobility, and is fearful of infecting his family with COVID due to his risk of exposure. Andrea, on the other hand, is part of the quality representative within the administration that manages the COVID-19 dashboard. She identifies as a woman, a heterosexual white woman. COVID-19 impacted her because she was burnt out. She lost faith in her purpose and feels unable to continue in her job due to shifts in duty.
So, from the lenses of all five of these members of the healthcare team, we created recommendations on three different levels to support radical belongingness. The first level we chose was on an organizational level. So, we came up with several recommendations, including improving employee benefits, such as increasing wages / paid sick leave, also increasing awareness for healthcare worker support throughout the community so that the community could have a role in helping support the radical belongingness of the healthcare. Also, improving the public's knowledge regarding where to go for certain healthcare services needed, which we did provide a chart on here of something that we could use as education for the public to know which medical center to use for certain symptom presence. We also talked about implementing a diversity, equity, and inclusion team in order to combat the racial inequalities present among the Black, Indigenous, and people of color populations within healthcare. We also talked about increasing staff as several of them felt that they were overworked and there wasn't enough staff on the floors. And we talked about doing this by creating incentivization programs such as paying more for picking up more hours, so on and so forth. And then we also talked about creating a wellness program that would be implemented by the organization itself. And some components of it would include physical, emotional, social, spiritual, and intellectual wellness. On a team level, we also talked about several recommendations to support radical belongingness, including having informational monthly team meetings in which a selected member would present on a certain topic. And some of the ideas we came up with included tips to combat burnout and overwhelmingness, stress management, navigating difficult emotions and situations, finding your purpose, and overall well being. We also talked about delegating equal work and clearly defining roles and responsibilities so that all team members felt that they were adequately doing what they should be and not being overworked. And then also just to create sort of like a team bonding experience and make people feel more comfortable in their work environment. We talked about having team outings such as happy or social hours in which they could get together outside of work, and then also having team bonding events just to create a more cohesive unit within the hospital. And then lastly, we came up with recommendations for an individual level, including stress management, combating exhaustion and compassion fatigue, avoiding feelings of isolation, increasing mental health awareness. And one way we talked about doing this was by implementing a liaison to be someone that individuals could talk to about their health and stress. We also talked about educating on the importance of acknowledging and addressing life outside of work, and then promoting the importance of wellness. And an idea that we had created to do this would be sending out weekly wellness emails by the organization, just to give tips and tricks of things that staff members might not think of on a regular basis.
And so in forming this kind of plan, one of the main questions we have to ask ourselves is how will this really consider, or will it even consider the marginalized communities and the different types of stressors that they go through, especially in regards to the setting of people that work in healthcare. So kind of when we were coming up with this plan, we have to really understand at a baseline, what kinds of things do marginalized team members experience? So before even the pandemic, it's kind of commonplace that marginalized team members, they have limited opportunity. A lot of them often have minimal support and they have limited choice. So they kind of are when the pandemic broke out, the same people now who have limited opportunity, minimal support, and restricted choice, now they have to deal and with the overbearing burden of economic turmoil. They need more physical, emotional, and financial support. And on top of that, at the time, it seemed as if there was a very uncertain future. And that kind of stands as it is today as well. So when we created this plan, we really aimed to do two things. One of which was to recognize that, a lot of these very foundational members on the healthcare team have a very much worsening burden amongst whatever they are already going through, and to not only recognize that, but to also provide an outlet of support with the hopes of reducing the weight of all these external stressors outside of their job in the healthcare setting. And as we mentioned before, we have a couple of different ways through both on an individual level and as a team level. And, as we're about to go through the next few slides, this plan hopefully is kind of going to really consider the impacts on these community members specifically.
So now we're going to go through some key implementation steps, both in the short term and the long term for this plan. So one of the first things we want to do would be to hold focus groups and send out surveys that include all roles in the healthcare system. and in the system as a whole for their people's input on the different programs that they'd like implemented and different aspects they'd like to see. So what would they like to see in a wellness program? What kinds of things would they like to learn about in these team meetings if we have presentations, and how can we best support them? Because if we're implementing these programs, we'd like them to be things that people who are working in the system actually would like to see. We also would need to meet with the organization's financial team to help determine different budgets and the ability to increase wages and incentives in our budget for hiring more staff to help actually implement this plan, to see what kind of budget we're working with and what we're actually capable of doing. We also thought it'd be good to meet with the organization's social media and advertising team so we could discuss building 2 campaigns, one of which that would be about supporting healthcare workers in the community, so we could get support in the community again for them, just like they were more at the beginning of the pandemic. It's kind of fallen over time, so it'd be a good thing to kind of do a campaign like that and get support again. And then another one, educating community on proper healthcare usage. So when you should go to the ER versus urgent care versus your primary care, so we can kind of help cut down on some unnecessary usage in the healthcare system, and which will hopefully cut down on some of the excess work that our providers are facing. We'd also want to begin an organizational search for possible members of our new Office of Diversity Inclusion. We'd first want to do a search coming from within the organization, because this can be an opportunity for advancement for people within our organization, and giving them the opportunity first to become members of this office shows that we value them and that there is opportunity for advancement here. And also they are the ones working in the system and know what can be done best to help it. So it'd be good to first look within. And then lastly, for our short-term plans, we would want to begin researching like curriculums, programs, and apps that can be brought in and implemented to teach about wellness topics at both the team and individual levels. So maybe there's some sort of program that we can get for these monthly team presentations we're going to be giving, or apps to promote individual wellness, things like that. So moving on to the long term, we would, after the results of our focus groups and surveys came back, we would want to review those to help further define what types of programs are most helpful to implement. We want to collaborate with our newly hired Office of Diversity Inclusion to fully define their role and determine what things they would like to implement after we had finished hiring people on. It would also be good to appoint a wellness/belonging officer to aid in the implementation of all these programs, and to ensure that after they're implemented, these ideas continue on long term and can evolve as needed with the growing needs and the changing needs of this healthcare system. And then we'd also want to continue at least yearly surveys and focus groups to continue to improve the program and gain new ideas as time goes on.
So we focused on 5 points on how we as a team can support this implementation. The first one would be to give the hospital stay and staff surveys every 2 to 3 months. By giving surveys, you can have a lifelong gaining tool for hospitals. So by giving these regular surveys and having people complete it, it keeps the hospital up to date on continuous needs that need to be met, that can ensure job satisfaction. And this also helps improve recurring issues such as new ways of brainstorming and helping improve the staffing environment and experience. The second point would be financial fairness equals staff happiness. So finance is one of the biggest and most relevant complaints among the 5 staff members that we recently talked about in this presentation. And it's still an issue that's being fought nationwide. So meeting with an organizational financial teams will help continue taking steps forward to promote fair wages. And then creating and developing social media page to promote health wellness. Health wellness is something that not many people are familiar with, but by educating the community through networking about proper healthcare usage is a prominent way to spread awareness in today's time. And then educating staff and community about wellness through apps, through flyers and hospital visits could be really relevant and really promising. And then constant communication with the newly hired Office of Diversity to ensure roles, to define roles and responsibilities. So the Office of Diversity will help by communicating with them, they'll help create diverse teams and boost creativity and innovation, better decision making, and make better opportunities for professional growth.
All right. So lastly, we want to be able to ensure that we're adequately assessing the success of our implementation. So we're mainly interested in whether our staff feel a sense of fairness and belonging, and they feel that their concerns are heard in the workplace. There's multiple avenues to make sure we're successful on that front. Namely, there's subjective measurements of whether we're successful, objective measurements, and then other things to consider are that at the end of the day, we are in the business of providing healthcare. We are providing healthcare to our patient population, and to ensure that we have upkeep in that regard as well. So starting off with subjective measurements, just ensuring that our employees are subjectively feeling that their voices are heard, they're feeling a sense of belongingness. And for this, there's a lot of research out there showing multiple validated questionnaires of some of which have been listed here. The general belongingness scale, sense of belonging instrument. The core idea is that using a validated tool from the past will help give us insight into how our implementation is being perceived by our employees, and then likelihood of our employees to recommend others to work there. So the idea is that if our employees are happy working there, they would be comfortable with, say, their family members or other loved ones to come join our institution. And then objective measurements. So subjective lets us know into how our employees are doing emotionally. Objectively, we want to be able to ensure that we're retaining our employees. So employee retention, mean number of years worked by our employees, how many of our employees are referrals, like internal referrals from currently working employees, and percent of our positions that are being filled by internal candidates, right? The idea is that if our employees feel a sense of belonging, then they're more likely to want to work up in the institution. And so that's a good metric of whether we're supporting our employees in progressing within this current institution, and also whether our employees see a future in our institution. And then other things are like absenteeism rate. The idea is that if our employees are not feeling supported, they're more likely to be absentee. Employee turnover rate. So again, if our employees are not happy, then they're more likely to be leaving the institution. And then external reviews, external ratings of our hospital as a workplace. So that's just like, online ratings of employee experiences where they're more likely to be a bit more candid. Then measuring healthcare factors. So after the implementation of these changes, we want to be able to ensure that we're still adequately providing care for our patients. So some metrics that we'd be interested in are before and after our patient mortality, number of complications after implementation, number of avoidable healthcare errors, and then patient satisfaction with the care they receive. The idea is that if our employees are happy, they're more likely to provide better healthcare to our patient base, and our patients are more likely to also feel valued. And then finally, just a continuous external audit, not internal, external audit and review of our healthcare system to just ensure that the implementation is successful. And so next slide. So in conclusion, this is our presentation. These are the team members that are involved in this presentation. Any feedback, any concerns would be very much appreciated. Thank you very much for your time.